found. And then they use these AI findings to further on wet lab to determine is it the real thing or not. Yeah, I think this is also another way other than just doing the expression studies and all that. Yeah. It's more to like meta-analysis, yeah.
Actually, you can suggest to us that if you want to have something like that, I don't know, this is until your wait a minute now is July, so you have another 3 months, right? Yeah. If you request to us to have that seminar from one or two topics, then on this, then we can actually arrange for you lah. Okay, maybe
That would be great, Doctor. Like if we have a seminar or a workshop about that kind of
maybe
subject.
Yuan can, because Yuan represent all of you, right? So Yuan can talk to. You can email to me. I can have. But please CC to my PA Aida. Yeah, we can organize for you lah. If that's I mean not for your project now, but then you can actually use that probably for your later in your PhD. Yeah. Okay. So any more view on this? I know this is a huge topic, but I just share a few things so that we will basically know that it can be used for research, can be used for hospital, can be used for clinic, and of course when doctors need something, that's why I put there clinician, because clinician is something, of course, they have no time, but they themselves, they have they are many of them who are also doing research. So when they don't have that, then we are biologists that actually do probably slightly more on the molecular part and genomic part, other omics part that can help them. And the tools for us, when we know all those things, of course, we need chemists, we need engineers and IT specialists for to look at the tools, so they can actually provide us the tools, and we know that, then we can actually utilize again. Of course, for drug target, you have to know there's a molecular docking simulation for you to know the binding of the drug and whatnot. That's that downstream part as well for me, because you need at first you need to choose which one first, and then to see more in before the wet lab, you can actually do docking and molecular simulation, dynamic simulation, to see whether the binding is good or not. Okay, so there are more possibilities for that. So I open again, you discuss among your group. You can represent if you like to have probably 1 or 2 hours seminar, so that it will open your eyes, open your interest to do research in this. Okay. So anything more? So 3 of you now in inform.
Pushpa.
Yes, Doctor. We
Yeah, 3.
Lab work, so we were here and have class, and then we will go to the lab.
So you have some more class? this afternoon?
No, like working in lab in our research project. Actually.
You started already your project,
Yeah,
right?
yeah, of course.
So everybody okay with the
Yes.
project? Or you have
Yes.
any problem that you can get results for the first time? That's fine. That's called research, right? So you've got to have fun in the lab. So you can expect that when you do research, it's going to be good results for the first time. So that's normal. You probably need to repeat. Yeah. So yeah.
Also,
So don't be, so triggered with that. Oh, I'm not good. I don't get good results. Talk to your supervisors because they can help you more in this. So my advice is everybody or you are all good. So yeah, if you don't get result for the first time, probably I always think that, oh, okay, that's probably not the good um, uh, protocols. Then you can change it and then discuss with supervisor and friends, because no point for you to be secretive, because I believe in discussion. I believe in sharing. I believe in, talking to each other so that you will get some idea from your discussion. Don't worry about, oh, people will use my technique. That's mine. Uh, how many of us here are Nobel laureate? I don't think we have. So because when we do research, we always refer to the previous research and we change here and there to make sure that we have this protocol, and then we have protocol one, and then we normally combine with other researchers. So yeah. Okay. Who's the guy with?
Oh, Jintao. Jintao.
Oh, Jintao.
Yeah.
Okay. Also, you are, whenever you are informed, you are actually there, right? Okay. Good.
All time
So
info.
talk to each other and discuss more. You can ask other lecturers as well, I guess. Yeah, for me, I don't believe in working in silo. This is mine. Nobody can know my project. Then it will give you, you would have depression more. Don't want to hear that. So yeah, have fun and make more friends. You can ask your. Of course, you have friends from other school as well, right? We don't expect you to actually discuss only among informers, because no, we can't. Yeah. So take your opportunity, as you are only 1.5 year and a half, right, for this. So take opportunity to make more friends, and I know some people talk some other things, but you can actually discuss your project, your research as well. Get opinion. That before we stop, I think. Yeah. Thank you so much.
Thank you, Doctor.
Yeah.
Thank you.
So all the best and have fun. Take care of yourself.
Thank you.
Okay.
Bye.
Bye. Who? Ra'at came here already, right? Who asked for to come? Come. You are all invited to come if you want to come to this site.
Inshallah.
Okay. Bye.
Inshallah. Thank you, Doctor. Bye.
Okay, bye. So far, it's just 1 hour by flight. So can you see my slide now? And can you hear my voice? Something. Okay. Okay. The slide is blank. Blank again. There's some problem with the what do you call? Oh, yeah. The slide is blank again. Is it blank? Yes, still. Some problem yesterday as well. We need to do this. Turn off background. Okay. Can somebody give your number so that I can give through? I can actually send the slides through your WhatsApp. Okay. This is Yen. I think because of the setting of the now, because yesterday got problem as well. For when we have our event yesterday. When they changed to, they upgraded the Webex, I guess. Wait a minute, yeah. Seven, 5, you received my okay. I'll send to you. Okay, please share with your friend. I'm here in Kelantan. Kelantan is already weekend today, so I can't ask everybody's help for this one. I'm at home. I'm at home now. So Yen, did you receive my file?
Yes, doctor.
Okay. Please, I'll put here as well. Okay, but I think This is Webex.
Receive.
Okay, anyway, I think everyone got the file. Yes, I can share the slides from my side. Okay then. Thank you. So, okay.
Seeing my slide, right?
Yeah, okay. Thank you. So you go to slideshow, it's easier, right? I guess, for everyone.
You tell me when to press next.
No problem. Okay. I have to connect to the connect to the
Cast.
okay. Thank you. Okay. Sorry. Okay. This is my position. Okay, next slide. Sorry, this topic is actually digital transformation in the eye in molecular medicine. So, so when we talk about the digital transformation, it is basically the integration of the digital technology into all aspects of how the healthcare business interact with patients, with healthcare providers, and also regulators. So when we talk about healthcare, for biomedical sciences, as well as the molecular medicine, because most of the time it's actually on the healthcare is actually connected to patients and healthcare providers and also regulators. There are some actually information where we do research as well. Of course, when we do research, it's basically a research that we do that will help the patient as well. Okay, so AI is artificial intelligence, is the stimulation of human intelligence processes by machines, especially computer systems, as you all know. But the AI is basically will solve some problem of the health problem, how to solve the problems for the patients that will actually benefit the patients and that will guide the doctors and help the doctors and or healthcare providers as well. Okay. Molecular medicine, as we are now, is science that seeks to comprehend disease causes and mechanisms at molecular level and to apply the basic research to the prevention, diagnosis, and treatment of disease and disorders. For us, most of us, when we are in molecular medicine, I don't see yet anybody that actually involved with yet now, because we are still in fundamental. So most of us that doing diagnostics is actually in vitro diagnostics. You know what is in vitro diagnostics? It's basically test kit that tests not implant to our body, but test from the samples like blood, stools, tissue or what, okay? Test done on samples such as blood or tissue or stools, urine, and whatever fluid in our body that have been taken from human body, okay? So it can detect disease or other condition and can be caused to monitor a person's overall health, to have cure, treat, or prevent the disease, okay? So next, Yin, next slide. Okay, this is just to show you where AI is part of this as well. As you can see, sensor, you can see 5G, you can see all those, because 1010 my STIE is basically the framework for Malaysian science, technology, and innovation in Malaysia. So you will see AI is part of that, where you will see Malaysian socioeconomic drivers and also the science technology drivers. So AI, this is part of them, as you can see, blockchain and so on as well in this slide. So at the moment now, when we do research, it's actually referring to, or it's actually involved or related to all these socioeconomic as well as the technology drivers. And the grant funding also, I think some of you have already, I think, or most of you, all of you have already chosen the topics for your research project, right? Yes or no?
Yes, doctor.
Yeah, so you already present your proposal?
Two of us haven't, but four of them are already done.
Some have already. So when you see the project is basically related to all this, the socioeconomics as well as the can match with the technology drivers. Anybody else differ from this? No, right? Okay. Sorry. Next. Yan, please, next slide. Okay. The artificial intelligence is basically useful in public health as well as medical education. So the category of AI use for primary is clinical decision making and care management, including symptom assessment, automation of clinical coding, image recognition for dermatology condition, triaging as well as self-management. There are cases where, like, for example, if you talk about stage, for example, the patient where it is related to the progression of the disease. So that's where it's proactive detection. Is analyzing patient record to predict patients with undiagnosed conditions. So at the prediction, there are detection whereby, let's say, for example, for cancer, you will see the images and you can detect the staging of the cancer itself. Or you're talking about knee osteoarthritis, you look at the x-ray and you will see the osteophyte and you see the distance of your joint, and it will basically it can basically detect the staging of the disease itself. Okay, next. Okay, this is overall the application in digital technologies in healthcare, where is the pharma, the hospitals, research, lab, outpatient clinic, and education. So when we talk about digital technologies, the pharma will basically involve with virtual clinical trials, electronic prescription, e-pharmacy, research, big data, and hospital is on the electronic health records, medical image data, claims data, billing and finance data. And in terms of research, I probably most of you have already learned about next-gen sequencing, genome-wide association studies, pharmacogenetics, research, big data and collaboration, and labs. Of course, you look at the patient data, the biomarkers data, the logistics, and also billing data. And outpatient clinic is on the patient's data, telemedicine, rural health, and wearables. And education is more on 3D modeling, AI-based platform, distance education, e-libraries. So all these is actually involved with digital technologies. Next. Oh, the internet is so slow. So this is the some of the AI application in healthcare. You will see ultrasound imaging, CT imaging, MRI, cancer diagnosis, and also drug development. So that's the application, but whereby you can actually look at the study areas and outcomes of that. And if you want to look at that, you can actually check more on these papers. Next. Okay. When we talk about this AI and the digitalization, so it cannot run away from big data and e-health. So big data is high volume, high velocity, and high variety information assets that demand cost-effective, innovative forms of information processing that enable enhanced insight, decision-making, process automation. And also it refers to the large diverse sets of information that grow at ever increasing rates, and it encompasses of the volume of information and the velocity or speed at which is created and collected, and the variety or scope of data points being covered. So big data is talking about all the database that have all the information. If talking about patient, then of course demographic data is there, the information of the diagnosis is there, including the sequencing analysis as well. And next. Okay, big data and health record, for example, the transition of electronic health records that can help to store, sort, and speed up the process of patient data. For example, if I think hospital need to do this, as they need to see in their records when anybody needs to have data, or their internal department needs to have data as the planning of the probably drugs that they have to order, and also how many patients inside there that they can, and what are the machines that really need to speed up the process of the treatment as well, okay? Diagnosis and treatment for them to manage well the patients. The replication of big data system in the management of medical practice has the potential to improve the quality, the efficiency of the service, lower the cost of care and number of medical errors. So because human, of course, human actually created all these systems. So, and the system will basically interpret whatever data that we want. And if we refer to human always forget all the things, most of the things. But when you press anything that you already put in data, have the system and everything, then you will be able to dig all the information that you need. Okay, big data as a platform that provides means to support, optimize, accelerate, and facilitate biomedical research. Also provide unlimited opportunities for finding new solutions in biology, medicine, genetic, epidemiology, and pharmacology. And with data also can help in sorting and analysis of the rapidly increasing volume of medical information. As I mentioned earlier, how many of you doing research in next-gen sequencing now? Yes, do you have anybody or not?
I'm not sure about
It's
others. I'm not doing anything about next-gen sequencing.
Anybody? Anybody involved with the data? No.
Yes, doctor. Like I'm just doing the DNA identification of my species.
DNA identification of the
Yeah, of my species that I'm using the medicinal mushroom. So I have to make sure like the one that I'm using, it's the exact strain that I want to study. So I'm about to do the deep sequencing for my medicinal mushroom.
Oh, okay, good. So there are information if you are doing on that, it actually refers to, let's say, for example, that just now is on the plant itself, and we refer to the infectious disease. Then what you need to do is, when at the moment now it's on the culture method, and we can actually sequence the genome of the bacteria itself, and we can see that any drug resistance of the of the organism itself, and we can actually look at what kind of drugs that actually suitable for the patient by looking at the analysis of data of that. Okay, that's one of example. Next. Yeah, okay. This is talking about sequencing. So big data can be used for analysis of data from next generation sequencing and study of wide genome association for decoding human genetics. So most of the work in USM, of course, in other at Info we have some. In School of Medical Sciences, there is a center called Genome Center under School of Medical Sciences. So they actually do all this sequencing for the genetic related disease as well as the non-communicable disease. So they are into the cancer, many types of cancer. They are into the I guess it's on the muscular dystrophy. They are on the cardiovascular disease as well. So I guess there are many analyses of next generation sequencing that actually meant for the genome-wide study as well as diagnosis of that by looking at the certain genes. And and when you are looking into another part is to treat the patient, then you can actually look at the gene that metabolize the drug. So you have to analyze each of the patient for you to make sure that they are actually respond to the drug itself. Okay, so otherwise you give the wrong drug, which is similar with others. It has to be personalized to the patient itself. Otherwise, some people might actually involve with might respond to drugs, some not. Okay, so the new era of omics, based on the big data platform, opens an opportunity for us now, okay, to explore and understand the whole genome, thus generating large amount of information with a greater depth of understanding, so that we can do more research, fundamental research, and that leads to the applied research for us to solve many problems of the disease for the patient, and also for the prediction of the disease itself. Okay, prediction can be done by looking at the SNPs, and there are targeted genes. There are genes that are related to the disease susceptibility. So you've got to basically look at the data, analyze the data itself for the sequencing of the targeted genes, and if there are SNPs in the gene itself, so that's probably involved with the susceptibility to the patient itself. Okay. Next. Okay, so big data, the integration of biomedical data is basically, as I mentioned, is quite strong integration of biomedical data from various sources such as electronic health medical records, or genetics, information of pharmacies, insurance records, in order to optimize diagnostics and treatment via a personalized approach, as I mentioned earlier. Okay, and world leading health organizations are actively taking measures to introduce and standardize the electronic health passport to strengthen primary health care and to facilitate the improvement, optimization of the quality of medical care, along with reducing the amount of paperwork for the medical professional. So we don't need now to basically record the patient data in a paper and put in a file and store. If of course there are some actually doing that, and the previous data, I mean, that we do, we need to have the health records in a proper place. But if we actually now, and when people go to the big data, or we can actually store in the computer, and then everyone can access. I mean, it's easier for the doctors or healthcare providers to get the information of the patient itself. Okay. Okay. Standardization is necessary to ensure the functional interaction between the electronic passport, health passport, electronic medical records, and or either health system, taking into account the requirement of ISO 13940. Okay. Next. So apart from the big data, another one is blockchain technology. Okay, blockchain technology is based on a peer-to-peer platform that provides an opportunity to securely store the information on thousands of servers. So this information can be simultaneously used and shared within a decentralized and open network. Everybody knows about, oh, you are all. For instance, during COVID in Malaysia, how many of you Malaysian? Yen, are you Malaysian?
In the class, it's only me Malaysian.
Oh, okay. In Malaysia, we have medical record. Let's say, for example, last few years that we been actually, involved with the COVID pandemic. So what did Malaysian government do is basically they put we have the what do you call the apps called My Sejahtera. My means Malaysia. Sejahtera is well-being. So on that, when the patient is actually infected, so they can actually put the data there and then also start to have the information of the vaccination as well. And when you infected with that, you go to the hospital and the record is there. So when you were infected that time, they are alert for that. And please check your temperature, please check your heart rate and whatnot. And then we have to actually enter the data of what are the symptoms. Is there any whether you got diarrhea, you cannot breathe properly and whatnot. So they will advise you accordingly. So if it is severe, I mean, if it is getting worse, then they will say that please go to the nearest hospital and whatnot. Yen, have you been infected before?
Yes,
How many times?
once.
Okay. I've been infected 3 times with different symptoms. So all the data is there. So they actually that's the example of the blockchain that they develop. Okay. So blockchain allows hiding the patient identity with the help of complex and secure codes that can protect medical data. So of course we cannot change, we cannot simply look at that. You look at yours, I'm looking at mine, but the synchronized thing is when you put the data about yourself, they can actually suggest for you where to go. And then there's some actually would like, because we have vaccination and the last one is optional. So when you put there you would like to have, then they basically instruct you where to go to the nearest center from the house. Okay, so the decentralized nature of the technology also allow patients, doctors, and healthcare providers to share some information quickly and safely. Next. Okay, that's the big data. Another one is smart devices. Okay, novel technologies such as radio frequency identification readers and near field communication devices can be utilized not only for collecting health information but also as communication platforms in medicine. So there's smart devices actually created a huge impact for healthcare, basically. So actually can create continuous data flow while monitoring the state of health that make the device the main source of massive data sets or big data. And intelligent platforms can be actually connected to various devices via Internet of Things to provide reliable, efficient, and personalized medical care. And also using smart and wearable devices, physicians can remotely monitor various health parameters. There are some that actually still in the process of research or it is going to evaluation of that device itself. So there are many smart devices. Of course, we need to actually, as we are biologists, how many of you non-biologists? Probably chemists, right? How many of you? what's your basic degree? Is there anybody that have basic degree non-biology related? Probably physics. Is there any?
No, doctor.
No. Okay. So, okay. So, biology is like us. We need chemists. We need engineers to make sure that whatever biomarkers that we put on the device or they can actually create it or develop the repeatable and accurate enough for doctors to use. Okay, so using smart and wearable devices, physicians can remotely monitor various health parameters. They are still in the process. I guess one of the university in Malaysia that created the device so that they can actually remotely see the pictures of the patient itself to make sure that people in remote area can actually be assessed by the healthcare providers. Okay, next. Next, Yin. Okay, this you I think you can see all those smart devices that basically involve with patient and including for heart rate, the ECG and so on. Okay. Next. So application in the telemedicine. Telemedicine is actually involved with the connecting all those data basically for collection, storage, and exchange of medical data, remote diagnostics, and patient monitoring, interactive telemedicine services, distance education, administrative use, e-pharmacy, healthcare integration, online health information, and general management of the health system and track patient movement and remote reception. With the disaster and quarantine assistance, developing countries, rural health care, industrial health, mobile health clinics, correctional facilities, school health centers, and delivery and transportation. So that's the actually area that involved with telemedicine. Next. So AI in health technology that involved with application in health technologies involved with AI, big data, the pharmacy, blockchain, smart device, medical education, virtual clinical trials, and telemedicine. So you will see all actually involved with the health digitalized technologies. So they are involved with the prediction, diagnosis, and therapeutics as well. And in terms of the medical education, they also involved with the distant education, flexibility of education, whatnot, and virtual clinics, especially for remote patient recruitment, and so on, and also telemedicine. Next. Oh, sorry. Yeah. So we come to the yes, I can't see anything here. Okay. So you can see me, right? Okay, yeah, okay. So so next we are talking about the diagnostics in digital age. So for diagnostics in digital age is basically make use of optical readers, mobile phones, and data transmission capabilities, utilization of immunoassay, molecular, and nanotechnology platforms to improve reading of results and data transmission. This leads to the real-time results to inform patient management decision and can be transmitted to a central database to inform disease. And it's actually involved with the control programs or to monitor programs toward elimination. Next. Okay, diagnostics is an important as pillar of healthcare system. As we probably some of you have seen this when Elaine actually mentioned that without diagnostics, medicine is blind, because you've got to diagnose first, then only you can actually treat that. Okay, so it's actually the information or the right information is important to know at the right time, and it can solve to the right person, give to the right people. Okay, next. So digitalization is linked data from diagnostic laboratories. Ian, next slide. And POC test readers and devices to provide data on testing coverage, disease trends, and timely information for early warning of infectious disease outbreaks, to inform design or optimization of disease control and immunization program. Data connectivity as act to control programs to monitor the quality of testing, optimize supply chain management, thus increase the efficiency of healthcare system and improving patient outcome. So everything now is actually on the patient AI digitalized technologies for patient healthcare. Next. This is some of the diagnostic technologies to transform disease surveillance. They are into the big space immunoassay, to that one is, I think that's the previous one. bit-based immunoassay and microfluidic immunoassay. This is both of these allow for digitalize the diagnostics for digitalized results. So you can basically take all these things into the readers, and readers can basically the readers will transmit the data to the database, and everyone can actually see. Everyone means the related person, like doctors, nurse, and so on. Okay, next. One of the things is also point of care molecular assays, which offer diagnostic platforms compared to the limitation detection of immunoassay. You will see nucleic acid, real-time PCR, isothermal in the the equipment itself, so you don't do manually. We have nanosensors assay that can be configured to handheld PDA type device and linked to mobile connectivity and GPS that will enable anonymized disease data to be sent to data cloud for real-time surveillance. Next. So it's for hospital and also health department or public health, because hospitals basically treat the patients. So they need diagnosis, accurate diagnosis, and quick diagnosis, so that it can be transferred to them, so they will advise accordingly for the management of the patient itself. And in terms of the treatment, they will advise accordingly, and the patient will be taken care of. Okay, so guide to aid the selection of diagnostic tests. Everybody is looking for AI, machine learning, digitalized technologies, whatever it is. It's basically need to refer to the guide for the selection of the diagnostic test, where you need to define what is the test purpose. Is it for diagnosis? Is it for disease monitoring, qualitative or quantitative? And of course, need to review the market, whether this AI, even though, because people at the moment now, when you look at the, refer back to the COVID pandemic. At the moment, initially when the COVID pandemic happened, the WHO came out with the suggestion for the real-time PCR, so all samples to be sent to the hospitals, and pathologists or lab staff did the test. Of course, it will take some time, because even though real-time PCR can do high throughput, but because it is it needs the sample prep. So when it needs sample prep, they basically will take some time for sample prep, and when they put in the samples for amplification, then they will see the result, whether it's positive or negative, right? According to the CT value for real-time PCR. And to solve the problems of that, industries came out with the RTK, which is lateral assay based technology. So people can actually look at, everybody can look at, test their sample, which is just look at the band, whether it's positive with 2 lines or negative with 1 line. So that's why it's basically needs to see the test purpose. So AI need to look that as well. So like for us in Malaysia, when we have that test, we have to upload the test into the apps, and they will advise it accordingly as well. So it will determine the test diagnostics. We need to basically for after review the market, we will see the regulatory approval for those who are developing this, or all developers need to manufacture according to ISO 13485 standards, and we need to have the CE or FDA to be sell in Europe, or FDA. In Malaysia, we have MDA, Medical Device Authority. Okay, so it means the test diagnostic accuracy under ideal condition means that we have to do the test performance. So we'll see whether the sensitivity and specificity is okay to be used. If the sensitivity is lower than 50, of course, it's not been suggested. In fact, they are looking for the sensitivity and specificity of more 90% or more. Okay. We've also need to determine test diagnostics accuracy in clinical practice with test performance at end user level. So when we develop the test, of course, test performance can be done in your lab, but you've got to give to the end user to do it yourself, that for themselves. Okay. Monitor the test performance in routine use, where it's you've got to cater for quality control, proficiency testing, train the end user. Otherwise, the result will be not acceptable. Okay. Next. So talking about laboratory testing for detection, example SARS-CoV-2. Of course, this testing type, you have so many testing type, and you've got to look at what are the specimen that actually involved, and is it easy to take. You've got to contact hospital or clinics, and what is the characteristic of the test, what they're looking for what detects the pathogens, what are the requirements, they require the temperature and whatnot. Okay, so you also have to look at the testing time, because we need the test to be fast, and also you have to look at the limitation of the test itself. If the limitation is more, then you've got to compare with others. Which one is the best? Either the testing time is shorter, is it expensive or not? Okay. What are qualities of that? Is it cost effective? Is the sample type, is it easy to get? Because you need to order, if the doctors itself, they need to order from the lab that, okay, I'm taking this for this test. I'm taking the other samples for another test. So that's why we need to have that. Okay. Next. This is sample location recommendation for patients with COVID-19. This is just example. So you will see whether, which one, specimen type, whether it's oropharyngeal, nasopharyngeal swab, bronchoalveolar, sputum, stool, or swab, anal swab. And which one is good for early stage, advanced stage, and recovery stage, and you have to look at the positive rate of the test itself. Okay, so those are the things that we need to consider when we choose this diagnostics, whether it's actually enough, AI enough, means that, because when the pandemic, you've got to report that. Okay, so I'm sure that some of them, I mean most of them, when they got results, because it's not automatically sent to the database, right? So the lab technologies, instead of doing tests in the lab, they have to actually get the data and then put the data as well. So it's two jobs. Now, if we have the digitalized straight away from the sample prep straight away. You put samples and get results. The result can be transferred to the database so that the doctors or health the department can actually know the results for them to actually analyze and give the instruction of what next to do, what should be done next. Okay. So next. POC, point of care diagnostics in communities, can be used to provide early warning of infectious diseases or outbreaks, timely information to inform disease control and elimination program. So they are point of care diagnostic. So use of diagnostics, next, to help clinicians detect disease, determine causes, monitor patient progress and improve outcomes. Products include devices to assist in clinical chemistry and immunoassay, urine analysis, point of care testing, patient self-testing and laboratory automation. Next. So 6 ways of big data can help improve patient outcome is, first is disease prevention and early intervention. Second, improve staffing and reducing healthcare administrative costs, because they just need staff to basically click something, not to do the lab tests in the lab. Facilitating information sharing between stakeholders, feeding data from variable tech, improving diagnostics and drug development, and also enhance patient engagement. So these are the some of the ways for helping patient outcome to improve the patient outcome. Next. So the advancement of the diagnostic platform is more IVD companies are shifting from creating new products to a more cost-efficient model of developing add-ons that increase the efficacy and accuracy of the tests with the AI and digitalized technologies. And the new generation of diagnostic equipped with digital technologies are transforming the field of clinical decision-making and disease control and prevention. So, like, for example, that I mentioned earlier, some of the software that can actually see when they look at the tissue that been staining for cancer patient, so they will know that which stage the patient having cancer, and they will look at which staging of the arthritis, whether it is just the patient just need the medication, and you can exercise more for arthritis, and you will get longer time. It will actually give you to reduce pain, and patient will live in reduce and more to reduce more and more pain, and you will actually be maintained, not in short period of time you have to do knee replacement, just for example. Okay, So that's the next. Role of diagnostics in clinical decision making is actually, of course, we have to actually we look at the incubation, means determine the risk of the disease, means similar with production. When we have symptoms, then of course you need to rule out whatever infection is that. And for treatment, of course, you need to actually determine drug susceptibility, initiate treatment and monitoring of the disease itself. Okay, that one is just for example. And these are the point of care nucleic acid platforms. It's platforms that actually have you put the samples and you get the results straight away after that, after sometimes. It's according to the time of the results, and some include the sample prep, some not. So you will need to see accordingly which one is actually suitable for your place. Next. Yen. Next slide. Hello, can you hear me? Okay. So these are the example of that. Next, this is isomers, where you can actually look which one is okay. You can actually put this in the smart device for you to get faster results, and it will be you will get the digitalized results. Okay, and we've seen lab on a drone PCR. That's the kind of the results is actually digitalized. And what else? Next. Yen, next. 29, next 30. I'm now at slide 32. Next slide. Okay, this is lab on drone. Next. Okay, so I prefer to actually look at this as we had a serious problem before, so everybody sort of pay attention to this before. I mean, people look at the how to solve this, and you think more on this SARS-CoV-2 that actually caused the COVID-19 pandemic. So there are approaches. Next slide, please. Approaches, whether it's qPCR, immunoassay, RT-LAMP, sensors, electron microscope, sequencing, lateral flow assay, CRISPR, virus isolation, but then you have to look at the symptoms itself and imaging findings. So there are approaches, and which one is digitalized? You have to look at that. People actually look at the sequencing, and there are, I think, WHO suggested to basically look at the variants, which variant is that, and whether it's giving severe problem to the infected people, or it's just giving you some mild fever and some you lost your case and everything, right? So that's why we need to actually look at the sequence and check which variant is that. Is it the one that caused severe problem and symptom to the patient? Okay. Next, there are competitive formats. I think I don't need to go in detail on this. Of course, every test looking at this lateral flow can be digitalized. When you put the fluorescent dye, then you can actually digitalize this. Okay, because you have to read using reader. Okay, so there are competitive formats where you label the antibody and you immobilize the antibody, then when the antigen binds from the patient, you will see the results. Okay, so the antigen test can be, for example, aptamer. Aptamer is actually, you have, normally for antigen test, you've got to have antibody so that you can capture the antigen from the patient. But the other way around, it's very difficult to get the antibody. Of course, you can get as long as you have money, but the antibody is expensive. So that's why researchers or scientists look at the alternative. So okay, we can actually develop aptamers where it's actually this short fragment that you can actually immobilize, so you can have like a mimic of or alternative to antibody, because this is considered as nucleic acid antibody when it is cheaper and then easier to get in short period of time. Then you can also use aptamer to detect antigen in the samples. Next, nucleic acid test. You can actually what next? Okay. The nucleic acid test, lateral flow. This talking a bit on lateral flow because lateral flow can be used for digitalize as well. So you can add you can actually I would say develop in either either you can actually immobilize the DNA or immobilize the protein itself, where you can get the amplified fragment. When they amplify, then you can see the signal, or when the amplified product, which is tagged to the protein, let's for example biotin, then you can also get the results whereby the nanoparticles bind to the conjugated to straight everything. So there are cases where you can see. Okay, when for SARS-CoV-2, of course, real-time PCR is best as the of SARS-CoV-2, or is a RNA virus. So what you've got to do is reverse transcriptase PCR. So basically to basically amplify this, of course, in a proper way, you've got to you've got from the RNA, you have to convert to cDNA, and cDNA will be synthesized, will be amplified to get more and more fragment. But of course, to shorten the amplification, you can actually put straight away like that in 2 steps to become 1 step. So you don't need to do it separately. It's a 1 step. You put the samples and put everything together, then you will straight away inside there transcribe to convert to cDNA, and the amplification happen at the same time. Okay. So next, this is just example for smartphone based lateral flow imaging system for detection of the next foodborne bacteria. This is just for you to actually look at, oh, okay, they are smartphone-based lateral flow imaging system. It doesn't mean that talking about lateral flow assay, because that's the simplest, I guess, to do. Even though you have to do all the optimization, but you can actually digitalize that by using smartphone. You can take the image and it can be digitalized as well. Okay, next. There's one example. The other one is lateral flow imaging box, where it's actually use smartphone LED light to redirect to a diffuser so that the specular illumination becomes more diffusive illumination, and you will see the results using this lateral flow imaging box. Next, the imaging process and calibration step. So you've got, during the process, you basically need to process what they did is actually process the image and calibrate, and even you can see the image there. So you will see that when you develop what is the detection limit of that. Okay. Okay. Next is cell phone based THS detection. So you will see like straight away the results that display on the screen. Look at F. Okay. Put the samples, insert the cassette into this, and then you will see the results straight away. Okay, that's digital. Okay, next, smartphone readout system for gold nanoparticle based lateral flow assay. You will see, you can actually, because this is the lateral flow smartphone imaging for home use. Okay, that's so which one is good? Is actually good for you to use, or I mean hospitals and whatnot. Of course, this home use, that no need for you to be hospital. You can actually talk to the doctors via online as well. So we have people are moving into this digitalized even to get the advice from doctors or health providers. Also, you can actually contact. Oh, okay, when you look at this and the information can be transferred to the clinic, then the doctors can actually look at the results. Okay. So digitalization of IVD, there's one, next. There's one, Abingdon Health. This is a company. I don't have any share with this. I just share with you that they have this apps, DX, adaptable cutting edge software for turning a smartphone into a lateral flow test reader. So you don't need test reader for lateral flow. So where basically when you put the samples, run the assay, and you get the results. Okay, then it will be transferred to database, so everyone can look at the results. Okay. So next, the illustration of geographical spread of confirmed COVID-19. That was long time ago. I mean, never mind. But they actually, when they test, so they need to, WHO need to know how many of that in these countries and how many cases in that countries. What is it the confirmed case by real-time PCR? So then they will collect the data, and that's why it's published by WHO. So they have the authority to basically get the data from each countries. Okay. Next is loop-mediated isotomal amplification on the microfluidic chip and detected at the end of the reaction. So at the end, you will see the smartphone detection as well. Okay. So it's much easier for detection. Next, on-chip detection workflow is deposit control at target primers. This is the also one of the LAMP reaction because it is in one temperature. So that's why the chip need to be heated at 65 degrees because of the PHT polymerase, the enzyme for amplification is actually at 65, and it can actually LAMP reaction, insert the chip into cradle and a point, fluorescent imaging, then you will result can be retrieved after 30 minutes because the reaction of the LAMP is around 30 to 40 minutes. Okay, real-time PCR basically took 2 hours. So this is just for example of the look. I think you have learned of this before. Next, we have DNA nano scaffold hybrid chain reaction based detection of the SARS-CoV-2 RNA. This is another example, and you can actually digitalize this. Automated centrifugal microfluidic system. So when you have the system, the centrifuge will basically lyse the virus, and then is followed by the amplification. Okay, so this is a fully centrifugal microfluidic system for sample to answer viral nucleic acid testing. So you put the samples and straight away see the results, whether it's positive or negative. Next is representation on action of smart band. This is another one that I think some of us use this, right? Body temperature measurement, blood pressure, step count, how many steps a day. Did anybody set for your own, like probably 10,000 steps a day? Did you? So are you doing that? Or you probably always walking in the campus and will have more than 10,000 steps a day? Anybody count? Yes or no? Nobody, don't care, just walk. Are you sleeping? Nobody
No, doctor, we don't count.
don't count. I think when you are at my age, then you will start to count. Whether it's 10,000 steps, or is it enough or not, you know? So yeah, people use also GPS tracker and then estimate the heart rate. Yeah. Some smartwatch can do, I think, including the iPhone as well. Next is plasmonic photothermal biosensor. All this is the optical sensor. So by electrochemical and optical sensor is one of the device that considers as digitalized because normally will basically look at the reaction to have the digitalized results. Okay. Next, wearable sensor for COVID-19 monitoring. So see, you can actually look at all these parameters lah. Okay. Collecting physiological data from a wearable sensor for COVID-19 monitoring. It can be used for others as well. Nanosensor, which use graphene for diagnosis, and you can actually involve with it's actually lead to the drug screening and in vivo treatment. IoT-ish gateway, where you involve with the heart, the telemetry data, and using machine learning, the anomaly notification, and IoT-ish function. So this is deployment of the machine learning on the IoT each gateway. Okay, potential of AI application. Where do you see the greatest potential of the AI application? Next. First is the increased operational efficiency, where you can actually reduce turnaround time, automate repetitive tasks, mitigate manual labor, improve test utilization, and also for this is the awareness and impact session in US level 3 before. So clinical decision support, where you can develop composite diagnosis, improve differential diagnostics, and provide targeted therapy, and enhance the data analysis, where you can process big data analytics, solve rare, unusual, and complex cases, and improve quality of test results, and also standardize care with the automate test and care protocols, extend lab expertise to less skilled labs, and expand access to patient care and lessen variability. Okay, so this is also example. Next. Okay, various AI supported approaches investigated for COVID management. This is the various AI supported approaches investigated. So you will see that, okay, this is basically involved with diagnostic treatment, specialist protection, map, information register, and consultation. So that the first one, B, is presentation of conceptual framework developed for various data collection and COVID-19 identification, considering geographical region-based approach, including city, country, town, village, and household. Okay, so that's the for COVID-19 management. Okay, that's it for now. This is some of the one that we use. Next slide. Okay, this is the one that the work at Inform. So next, what we need to have is multidisciplinary collaboration. So as biologists, we need chemists, we need engineers, we need IT specialists. Of course, we need clinicians as well, because they are the one that require all those gadget, all those systems for them to actually benefit the patient. And of course, we need also public health specialists for them to because they need a AI, they need the digital technologies for surveillance program. Okay, to basically look at as a whole, for prevention, and also get the epidemiology data from that. Okay, of course we need bioinformatician and also biostatistician. So now, okay, I think that's all variable sharing part from my side. Now, what we need to, for you to, I think I need everyone to basically share a little bit on what you know, and what do you think the advantage and disadvantage of this AI and digital technologies for biomedical research or healthcare? Anybody? Yeah, I have to call one by one so that you can. I will, because this is discussion. I hope that you all take part. So to basically shorten so that I'm going first, or you no you go first. So can I, or you want any volunteer first? Because everyone has to talk.
Hi, doctor. I'm Yun.
You okay, yeah.
So I'll go first. About the advantages and disadvantages of AI in biomedical research. So for the advantages, I see that if we are to incorporate AI for research in biomedicine, we'll have increased speed of drug discovery and development. So basically, when we look at 20 years ago, drug development will be like very slow. However, currently our drug discovery speed will be increased because there's incorporation of AI in this process. And since last time there's most of it are lab based, everything has to be done on lab base to give data. Nowadays, we can incorporate AI for predictive analysis, and maybe in future, AI could be incorporated for personalized medicines to tailor treatments for patients. And because we can collect data from patient and use AI and machine learning to help analyze what is happening to this patient, and then we could actually give very targeted treatment to the patient. And the disadvantages of AI in biomedical research might be the transparency, because currently we don't know if AI where do they store our data, and these data, are they leaking to anyone? And this might cause like trust issues, and due to the lack of transparency, and some of the clinics might be skeptical as well to adopt AI solutions in clinical settings. And also, there are implementation challenges because some of the lower income or middle income countries might not be able to reach this kind of technologies at the moment due to constraints in technology and also economical wise. So yeah, it will become a social imbalance or bias for higher income countries to have this more better diagnostic method or treatment methods, but in lower and middle income countries there will be less and less of this less um, uh, availability of this technology. Yeah, that's all about my uh, that's all. Yeah.
Okay, good. Anybody knows? Okay, before that, because you're talking about the disadvantage of about the data. You know, everybody, anybody knows about the act, because there's special act actually involved with the the data.
Okay, me.
Sorry. Yeah. Right. Please.
Yeah, disadvantage use the AI data found the more disadvantage. You can found error in analysis data, and found the ethical issue during the analysis data, and you can support the use analysis data. The human not can work anything, because the AI can making the analysis, can help take treatment, can make anything. This you can the effect of the ethical analysis, ethical result. Some country do not have the money and making the analysis, making the AI, this you can effect because not take the good analysis in analysis for the making the machine learning, making the drug and analysis the analysis the result.
Okay, Ra'at, what are the advantage that you think that it will give impact to everyone?
Okay, advantage you can help the good result, help the speed analysis result, help the patient found stores the large data about any patient, about disease, about the drug. This can help the analysis the for history the patient. My father have the heart disease. I found the central heart in my country. The central heart used this data. Now, any place in my country, my father go the central heart, already use the name or the number. You can see the any formation about disease, about the drug, about analysis. I think this advantage for use the data application in medical.
Okay, what about Sana? Any view from you on the advantage and disadvantage?
Hello, doctor. Hello, doctor.
Hi.
So, as my friend, both of them, that they have mentioned some of the advantage of this AI that help us with the, administrative work in the healthcare system, and especially with the one with us, like molecular medicine. So, first of all, as Yin, she mentioned AI in drug discovery that helped with the shortening the period of the drug discovery. This is the first one. Secondly, helped us with the finding the biomarkers for the cancer diseases, and also all the especially we are saying like communicable diseases, and also like help it with the understanding more of the molecular mechanism of the diseases, especially with the cancer and infectious diseases. Also with the help it also in like molecular imaging that helping with the diagnosis of the disease that I've mentioned. I think most of its advantage of this AI in this area that the area that we are in, it's just fastening our ability to reach to the like the goals and the obstacle, the pedestal that we have put in our research aim to reach. And there is another one also like with the AI and bioinformatic one that we know before like going for the clinical trial or treating animals or the inside the in vivo assay, we can just study the virtual one and protein interaction or structural sorry biological system studying before like implementing in the in vivo studies.
Okay. Song. Sana, you want to say something else, or you've done?
No, doctor, I just wanted to know, like, have any question or you want me to explain anything more?
No. I just want to focus on the advantage and disadvantage first, so that everyone can actually give ideas on this. You can actually choose any example. That's
thank you so much. This is a very important topic that we covered today. Thank you so much, and I wish we can have more during even as a workshop or anything, because nowadays like AI drug discovery, just like the hot topic around the world. And, you know, they opened a lot of the PhD position and master student, like, you know, like doing that area. So I was so happy today when I saw like the topic of our seminar today. Thank you so much, Doctor.
Thank you. Song, any ideas on that? On the advantage and disadvantage? What we can do, Sana, thank you for your suggestion just now. We can have on that this AI in medical research or okay, and give probably 10 minutes view on sharing session for the students. Is it okay with that or not? Then we can actually invite other AI specialists, you know, for them to comment on that as well. If you have time for that, if you think that that's the best for you, I mean, everybody agree with that, then we can have that. Okay, Song, please. Or
I think this advanced technology can provide a highly accurate and repeat results, enable a timely and precise diagnosis of disease. And big data analytic and the AI also can provide a personalized treatment plans based on individual's patient data. And AI will also reduce the workload on healthcare professional and minimize the errors and increase efficiency. And sometimes it can also reduce the administrative cost. But we also should consider is data privacy and security. Protect the patient's data from breaches and ensure its compliance with regulations. There is.
can you give example? I'm yeah.
Example. Previous I saw AI. The AI developed by a DeepMind can analyze the air scan images and it can diagnose over 15 types of air disease and I also say it can faster than some professional professional doctors.
Okay, and what's anything from you, Song?
Oh no, that's all.
What's the disadvantage?
Disadvantage is sometimes its data may data leak.
How to avoid that?
Sorry?
How to avoid the leakage of the data?
Do good data management and
What do you think that
do some
we needed for that?
improve some technology.
Sorry, say again.
Improve some technology.
Improve strategy like what?
Like sorry.
No worries, no worries. Anybody would like to help before I go for another person?
Doctor, I'm Yen.
Yeah, Yin. Yes.
I think there should be regulations, right? I mean, within protecting our data for to prevent it leaks to other companies like especially like AIA, those insurance company. Because what I heard from because currently next generation sequencing is very a hot topic, and I heard that our genomic data are stored, but in Malaysia I think there are not very regulated yet. I mean how this data was stored. But I heard that in Singapore, there is very strict regulations on this, how they store the data, and the data are stored by National Institute of their government or something like that. Yeah.
Yeah, yeah. Thank you. There should be a policy or regulatory in each countries for this. I think people are debating on that, and some actually implemented already that they should follow the whatever regulatory in India is in the EU or US. Of course, the policy should be there. Okay, thank you, Yen. Who else? Tapa? There's another one. Who's?
Hello, doctor.
Hi. Hi. Yes. Yes, please.
Okay, the advantages of of AI in the molecular medicine or in the science field is that, first of all, it speeds up the research in the research. For example, in like talking about the Human Genome Project, initially it took about like 5 years to complete the first Human Genome Project, but nowadays the whole genome itself can be
Okay.
sequenced within a few days. So this AI, I think they can like speed up the processes. And another advantage is that they can be used to discover new drugs easily. They can like predict the models, and then they can suggest which medicine could work or could not work. And another thing is that they can help us to develop a personalized medicine based on our individual genes or genomic makeup. And then for the advantages, there will be an issue of the security. We cannot, since AI itself is man-made, and then man-made is obviously not perfect. So there could be problem with the security. Data could be breached, and then if it falls into the wrong hand, it could be used for wrong things, wrongdoings. And then another one is like the ethical issues, I think, because yeah, and then another one could be like since AI, they are doing everything that we can do. For example, in the hospitals, they can do the scan, and then they can just get information of the patient. So in a way, I think they would replace the jobs for humans. So it could kind of lead to unemployment for the people, and then this is, since humans will be replaced, there will obviously be some economic crisis because of this, I think. And then another issue is AI, they are not, since it's a computer and everything, the system, and it's not gonna be cheap. So not everyone, I think not everyone can get access to it or afford to it. So I think it's gonna be expensive, and also maintaining this AI system is not gonna be easy. For example, even in our labs, we have this, even in Inform labs, some of the machines, they cost like millions, and then the maintenance costs more than the original cost. So yeah, I think it is one of the disadvantages that it's going to be highly expensive too. That's all from my side.
Okay, thank you. Next, please. How to pronounce your name? Gao. Is it Gao or Go? Hi, hello. Are you there? Everybody here in Malaysia or some actually outside? Means
All of
in
us are in Malaysia. I'm not sure where it's come.
yeah.
Let me
Be-
call him.
Yeah. I know that he's there. I'm not sure whether just open and then he went somewhere else. Because this session is not only the sharing part from my side. I need to hear from you so that I can give marks. Otherwise, you get 0. Difficult. I mean, I know we don't have exam in this semester, so these are some of the activities that will give you some results for your final marks for this 529. Any hi, are you there or are you somewhere else? Can everyone on the video for a while?
Okay.
Yeah, can on video for a while. Can off after that lah. Don't be so shy. Yeah, hi. You are yeah. Everybody, I mean, you are beautiful and handsome students. Why off your video? Okay. Okay, Gao. We need to song Sana, please on your video. I would like to know your input, your comments on the advantage and disadvantage of AI or digital technologies in medical research or healthcare setting. Any input from you?
Sorry, wait for me.
Everyone, where you are in your room or you are not yet informed? Are you yet informed?
Hello, Doctor.
Hello, Doctor.
We are
3 students.
like
Okay, okay.
let's go.
Yeah, I can see.
Okay, Doctor.
Oh, okay, okay. Good. Go, can you talk? Or you
Yeah.
can't?
Okay. I think the advantages of AI in medicine research and healthcare, diagnostics. Mm, like we can make earlier detection. AI can analyze the medical images and patient data to detect these. Mm. And he also can predict the disease progression and patient's outcomes uh, to
Okay.
to make the personalized medicine. and all the they also can resolve the information to make a drug discover. And also like the remote monitoring, remote monitoring and remote medical, we can get the better medical technologies. And finally, AI can also process and analyze the big data, genomic, the big genomic data to identify genomic markers or other clinical shows, clinical trials, yeah. And for his disadvantages, because AI is a computer technology, so we need more money to cost to maintain his to maintain its like update training to yeah it's effective and scale, and the data privacy and security is also an important issue. Handling large amounts sensitive patient data raise concerns about privacy and the patient for data breaches. Yeah, I think that's all me.
That's all. Thank you.
Thank you.
Now, please on your video. Want to
Okay.
see a handsome photo. Your I'm going to take this picture now for me to send to your course coordinator that you are here today. One, two, three. Okay. So, anybody want to say something about the
Sorry, doctor, we are just using this one. I just wondering, like, there is any research going on within USM, even from Clinton or main campus, about AI drug discovery or AI biomarker discovery?
There are some.
There's any project about this kind of this area of research?
Yeah, on particular project, I don't know, but there are some actually looking at the biomarker from the disease itself lah. So because at the moment, because AI can be anything, looking at biomarker, of course, I think the best way is actually for you to look at the specific genes, because you can actually look at the specific protein itself, which one is actually present, but of course by using AI you can actually predict and you can actually confirm by wet lab. There are few lecturers in School of Medical Sciences, particularly in Genome Center, that actually look at the more on the sequencing part of this. Of course, some actually work with engineering team to have whether it is data and also computer science to look at the I mean how would I say this algorithm for us for us to basically came up with the probably AI assisted tools for disease progression, for disease detection, and for choosing the biomarkers itself. Okay.
Thank you so much,
Some
Dr.
some actually work on the SNPs on the sequencing. Yeah, SNPs is another one that can be used as a marker. So what you can do is actually you cannot use one gene, because the best way is actually to sequence the whole genome. Man, it's actually huge work. So I don't think it can be done in short period of time. So the best way is basically to look at which protein or genes that actually involved by looking at the literature, and from there you can actually narrow down to get not only one, but I guess as a biomarkers you need to have few genes probably, then few genes to basically give the better idea on how biomarkers can be chosen. So yeah, because those days when we have the, I mean, there are because at the moment now only we can actually utilize, but of course some in some sequence on their own, like School of Medical Sciences, they have sequencer, but for us we send sequencing because we have to look at what we want to do. If we want to have biomarkers, then sequencing we let other people do, and then we analyze that, then it's easier rather than we have to put our effort to optimize the sequencing itself, and after that analyze the data and see which data can be used. So which markers, which signatures that can be used for diagnosis, and also that can lead us to the treatment itself, or probably for the monitoring of the treatment. That's called companion diagnostics, but it cannot be one. It has to be more than one. So yeah.
Yes, Doctor. Yeah, I see from your explanation, like this area of research is need a lot of like sequencing and first like generating data and then analyzing the data and then developing AI or using AI in Malaysia. I think like right now just in the beginning stage of that research area, just like about to start, because I see like most of the research right now, like most of them like goes to the sequencing and transcriptomic and things like that. So I think maybe in the future there will be like AI drug discovery or biomarker discovery research area, just like how right now we are like cancer research is just strong enough to do the research.
Yeah. Okay. If
Thank
you would like to basically explore more on this,
Yeah.
I'm not sure now, because those days I look at every day as I don't have money to go outside. So when I started to be a lecturer, I'm so poor. I was so poor at the time. So what did I do was because they are courses that been organized by what's that name? Welcome Trust UK. So there are courses which is related to AI, sequencing, analysis and whatnot. I guess they still have that. I don't have time now to actually look at that, as I think I went there twice and they support me in terms of, bursary and all that. So those days, they basically have
found. And then they use these AI findings to further on wet lab to determine is it the real thing or not. Yeah, I think this is also another way other than just doing the expression studies and all that. Yeah. It's more to like meta-analysis, yeah.
Actually, you can suggest to us that if you want to have something like that, I don't know, this is until your wait a minute now is July, so you have another 3 months, right? Yeah, if you request to us to have that seminar from one or two topics, then on this, then we can actually arrange for you lah. Okay, maybe
That would be great, Doctor. Like if we have a seminar or a workshop about that kind of
maybe
subject.
Yuan can, because Yuan represent all of you, right? So Yuan can talk to. You can email to me. I can have. But please CC to my PA Aida. Yeah, we can organize for you lah. If that's I mean not for your project now, but then you can actually use that probably for your later in your PhD. Yeah. Okay. So any more view on this? I know this is a huge topic, but I just share a few things so that we will basically know that it can be used for research, can be used for hospital, can be used for clinic, and of course when doctors need something, that's why I put there clinician, because clinician is something, of course they have no time, but they themselves they have they are many of them who are also doing research. So when they don't have that, then we are biologists that actually do probably slightly more on the molecular part and genomic part, other omics part that can help them. And the tools for us, when we know all those things, of course we need chemists, we need engineers and IT specialists for to look at the tools, so they can actually provide us the tools, and we know that, then we can actually utilize again. Of course, for drug target, you have to know there's a molecular docking simulation for you to know the binding of the drug and whatnot. That's that downstream part as well for me, because you need at first you need to choose which one first, and then to see more in before the wet lab, you can actually do docking and molecular simulation, dynamic simulation, to see whether the binding is good or not. Okay, so there are more possibilities for that. So I open again, you discuss among your group. Yuan can represent if you like to have probably 1 or 2 hours seminar, so that it will open your eyes, open your interest to do research in this. Okay. So, anything more? So 3 of you now in inform.
It's Pushpa.
Yes, doctor. We
Yeah,
have
3.
Three, right?
lab work, so we were here and have class, and then we will go to the lab.
So you have some more class this afternoon?
No, like working in lab in our research project.
So you started already your project, right?
Yeah.
So everybody okay with the
Yes.
project? Or you have
Yes.
any problem that you can get results for the first time? That's fine. That's called research, right? So you've got to have fun in the lab. So you can expect that when you do research, it's going to be good results for the first time. So that's normal. You probably need to repeat. Yeah. So yeah. So don't be, so triggered with that. Oh, I'm not good. I don't get good results. Talk to your supervisors because they can help you more in this. So my advice is everybody, or you are all good. So yeah, if you don't get result for the first time, probably I always think that, oh, okay, that's probably not the good protocols, and you can change here and then discuss with supervisor and friends, because no point for you to be secretive, because I believe in discussion. I believe in sharing. I believe in, talking to each other so that you will get some idea from your discussion. Don't worry about, oh, people will use my technique. That's mine. How many of us here are Nobel laureate? I don't think we have. So because when we do research, we always refer to the previous research and we change here and there to make sure that we have this protocol, and then we have protocol 1, and then we normally combine with other researchers. So yeah. Okay. Who's the guy with?
Oh, Jintao.
Oh, Jintao.
Yeah.
Okay. Also, you are, whenever you are informed, you are actually there, right? Okay. Good.
All time
So
info.
talk to each other and discuss more. You can ask other lecturers as well, I guess. Yeah, for me, I don't believe in working in silo. This is mine. Nobody can know my project. Then it will give you, you will have depression more. Don't want to hear that. So yeah, have fun and make more friends. You can ask your. Of course, you have friends from other school as well, right? We don't expect you to actually discuss only among informers, because no, we can't. Yeah. So take your opportunity, as you are only 1.5 year and a half, right, for this. So take opportunity to make more friends, and I know some people talk some other things, but you can actually discuss your project, your research as well. Get opinion. That before we stop, I think. Yeah. Thank you so much.
Thank you, Doctor.
yeah.
Thank you.
So all the best and have fun. Take care of yourself.
Thank you.
Okay.
Bye.
Bye. Who Ra'at came here already, right? Who asked for to come? Come, ah. You are all invited to come. If you want to come to this side.
Inshallah.
Okay. Bye.
Inshallah. Thank you, Doctor. Bye.
Okay. Bye. So far, it's just 1 hour by flight.